I mean, talk about imaging. I mean, long before anybody else was looking at how to see better, see deeper, subcellular imaging, and the so-called commercial product with OCT, you published the first paper on OCT showing
The Doppler
the
effect.
Doppler effect of OCT,
Yeah.
the first paper in the literature, and you had a tremendous relationship with the Princess Margaret folks on the imaging side.
Yeah.
And how did that, I mean, how the heck did you think of that?
Well, you know, again, it's the journey. I remember it was about 1987 or so that I went to a meeting in Los Angeles that had to do with autofluorescence. And I can't really remember where I ever first heard about it. But there was a meeting, and again, the people that were in it were the respirologists, and so they were doing bronchs to detect early squamous cell cancer in smokers, and that really grabbed my curiosity. And at that time, there was nothing in the GI tract. I think there were maybe one or two centers that were working on it, but the one, by good fortune for us, happened to be in Vancouver, a company called Zilix. And I remember going to the guy and saying, geez, you know, GI is a much more important field and a lot more disease than the lung. Why don't you focus, why don't you look at the GI tract? And he said, well, you know, we're a small company and by whatever, we've decided to go on lung, but as soon as we get this going, it's the GI tract. And again, being, and I say this, very simple and not so sophisticated in things like physics, I happened to know, and that time, very briefly, Brian Wilson, who is a photobiologist, photophysicist by trade.
How did you know him?
Well, I met him at a imaging meeting where I went
Really?
just because I didn't understand it, and that was how our relationship started. And then when Zillich said they wanted to look at the GI tract, and I must say, even to this day, I don't quite understand the physics of all these things. So obviously, I needed somebody smart to figure out
How to image the GI tract.
or how it could be applied to
Right.
to scopes, and that was the beginning of a very good relationship between us and the photobiology group at the University of Toronto, and now they're mainly focused at the Princess Margaret, and so it came that that's how we started, and then obviously Zillich was a small company with a sort of one technology, and they needed an endoscope. And then Olympus was involved, and that started another good relationship. And our relationship with the photobiologist has continued through the autofluorescence, the OCT, and now, which I think might be even another very important imaging thing, which is called photoacoustics, and the use of contrast agents, new contrast agents, and I think PDT is going to come back with a vengeance.
Really?
But not with
Photo frame.
For sure,
So you feel there'll be new photosensitizers,
New
better
photosensitizers.
tolerated? And
Yes, for sure.
so do you remember the worst reaction to photofrin, the photosensitivity?
Boy, I can remember it was almost, it's a terrible thing to sort of say this about anyone, but he just, and again, it's always communication with patients. And we always say to them, well, don't go out into the sunlight. And this guy said, oh no, I'm only going from the hospital to my car. Well, it was a sunny, cloudless day in Toronto, and he had to walk about 3 blocks, and he was like a turnip within 2 or 3 days. Fortunately, the blistering and everything healed without scarring, and he went on actually to do. He had a early carcinoma in Barrett's.
Really?
And he was cured.
Yeah.
But no, and I think that's the photosensitizers. I think will be another little niche. And so it's been a up and down journey.